Hello, I'm Sue. I'm a cancer patient and I co-chair Voice, the St George's Cancer Patient Group. We work closely with the cancer teams to offer you a series of videos to support you when living with and beyond cancer. We aim to help you better understand your care, know what to expect before, during and after treatment, what you can do to look after yourself, and how to find the right support for you and your loved ones.
Hello, I'm Amy. I'm one of the oncology nurse specialists. At St George's Hospital, we have two specialist day units, Trevor Howe Day Unit and Ruth Miles Day Unit. Trevor Howe Day Unit is located on the third floor of Lanesborough Wing, treating many different types of cancers. Ruth Miles Day Unit is located on the second floor of St James's Wing and is a haematology specialist service treating a range of blood cancers and other blood conditions. Both day units provide systemic anti-cancer therapies, you may hear us say SACT for short, as well as other supportive treatments. There may be occasions that we will ask patients to attend the wards for treatments such as when treatment is administered over a few days. SACT is a term used to describe all types of drugs used to treat cancer, including chemotherapy and immunotherapy. This may be given in the form of oral medication or different types of injections. Your nurse will explain what you have when you attend for your pre-treatment appointment. For most patients, you will attend the hospital 48 hours prior to your treatment to be seen by your doctor in the outpatient department. This is to assess if there have been any side effects from treatment and to assess your overall wellness. You will also have a blood test done at this point. Your team will provide an appointment card which tells you on which unit you'll have treatment and which department will take your tests. Either on the day of your first treatment or prior to commencing it, you will have a consultation with the SACT nurse on the day unit. You'll discuss your treatment regime, plan of the day, potential side effects, and advice on how to keep healthy at home, as well as how to escalate concerns. Please make sure you bring in a list of any current medications you're taking. Before your appointment, take the time to think about questions you want to ask. Everything that worries you, you didn't understand before or are uncertain about. No question is a silly question, and your team is here to support you. They understand how overwhelming it can be and how much information there is to take in. So just ask and feel at ease.
While everyone will have different treatment plans, there are some common tips we can share. Get comfortable. Wearing warm, comfortable, loose clothes during chemotherapy is a good idea. Some people get quite cold, and the nurses will need easy access to your arms for the drip. Water, water, water. We know it can be difficult, but please drink plenty of water before, during and after chemo treatment. Drinking lots of water will help to flush the chemo through your system and can also help to keep your bladder from becoming irritated. Keep a diary of any side effects. There's a very real side effect called chemo brain, which may make you feel quite fuzzy-headed or not able to remember things as well as you used to. Keeping a diary means you and your doctor or cancer nurse can easily check back. It's also a good way to keep track of how your body reacts to treatment. This can give you some idea of how you might feel during future cycles. You may know when you need more rest and when you may feel better and can plan to do something nice. Making your way to and from hospital. If you will be driving to your appointments, you can apply for a discount £8 daily permit or £10 weekly permit. Hospital transport is also available if you're entitled. Please ask the outpatient or day unit nurses for more information. You might want to organise for someone to pick you up. After a long day, you may feel tired and might welcome a lift. It's a good idea to bring your own personal entertainment to keep you busy if it will be a long day. The hospital provides free Wi-Fi for you to access. Please ask one of the team if you require assistance. If you will be in the day unit over lunchtime, you'll be offered a selection of sandwiches and snacks. Hot and cold drinks are available throughout the day. You're welcome to bring in your own food and drinks, or purchase from one of the many shops and cafes on the hospital site.
This video aims to support you when having systemic anti-cancer treatments, often referred to as SACT for short. It is your consultant who orders your treatment with our pharmacy, where it will be prepared on demand. All prescriptions are individually prepared following instructions from your clinician and made on the day of treatment. On each visit to the day unit, the nursing team will complete a few tests to decide if you are fit enough to have the treatment. They will also measure your vital signs, including your blood pressure and temperature. For certain treatments, additional tests may be required, such as urine tests or ECG. The nursing team will let you know if this is required for you. The team won't be able to pick up your treatment at a pharmacy until they know your test results are satisfactory. So you may experience delays in starting treatment. A member of the team will counsel you on any medications you need to take home as part of your treatment plan. If you have any questions, please inform the nurses and they can discuss with the SACT specialist pharmacist. Some SACT treatments require you to receive supportive medication in the form of an injection under the skin to help improve your immune system. If able, we encourage our patients to complete this themselves at home, as it is a simple and easy injection. If this is part of your treatment regimen, you will be provided with training and equipment.
Hi, I'm Dal Domingo and I'm the lead nurse for the Acute Oncology Service. With treatments specifically designed for you, the side effects will also be individual. Side effects of treatment will depend on the types of drugs you are having. Different drugs cause different side effects. Your doctor and nurse specialist will explain the side effects your treatment is likely to cause. You may get some of them, but you are very unlikely to get all of them. It is very important that you tell your team which side effects you are experiencing so they can help. Ask your nurse about the cancer research diary to help you keep track. Some side effects are mild and easily managed with prescribed drugs to take before and/or after treatment. Other side effects can be harder to manage but can often be reduced or helped in some way. Often, the main areas that are affected are where new cells are being quickly made and replaced. Here are some of the main side effects that you may experience and what can be done to help. Your white blood cells count may be reduced, and as a result, you may be prone to infections, which could delay treatment. Taking your temperature regularly will help monitor how you are and advise if you need antibiotics. With your immune system being very challenged by your treatment, risk of serious infection, sepsis, will increase. You may feel very anxious at the word sepsis, but the importance is to be vigilant with your symptoms. Do not wait to report any signs of infections, like changes in temperature, urine, or skin. Make sure you and your loved ones have your AUS hotline cards. You'll know it as the yellow card, and call us if you feel you need to. Your red blood cells count will also likely be reduced, and you may become more tired or feel like you have no energy. Do not hesitate to call your nurse specialist or consultant for a prescription and advice on how to manage fatigue. The team will advise you if your treatment may affect your hair, as you may lose it or it may become thinner. At St. George's, we can offer access to a wig specialist ahead of losing your hair, and the Macmillan Center team can help you find a trained hairdresser, headscarf tying workshops, and access advice for hair, skin, and nail care. Mouth problems may happen in different forms like soreness, ulcers, and taste change. Taking care of your mouth is really important but can be difficult when sore, but try to keep a daily routine with gentle cleaning and flossing your teeth. Keeping your mouth moist is key, so drink plenty of water throughout the day. Gravies and sauces added to your food can help, also if swallowing is difficult. You may experience a change in your sense of taste. This may be due to the cancer, or it can be a temporary change following cancer treatment. Experimenting with flavoring like seasoning, marinating your food may help you enjoy your food better. Your stomach and bowel can be affected in different ways. Depending on the type of treatment you are having, you may feel sick or be sick. Usually you will be given anti-sickness drugs before and after treatment, as it can be easier to prevent than treat. Other symptoms may be constipation, diarrhea, and loss of appetite. In all cases, keeping hydrated is important alongside managing to eat well in between treatments. If it becomes too challenging, do call your clinical team. Steroids are sometimes given alongside your treatment and may cause some unsettling side effects like indigestion, increased appetite, feeling more energetic or restless, or having difficulty sleeping. The treatment will often be given for a short period of time, and afterwards you may feel tired and a bit low in mood and have aches and pains. It may take 2 or 3 days to get better. Side effects like tiredness or feeling sick or weak can reduce your sex drive and make having sex difficult. It can help to talk through any concerns about your sex life with your doctor and nurse. It is also important to try to talk about how you feel with your partner. Cuddling, touching, and stroking are good ways of showing your feelings if you do not feel like having sex. If you have sex in the first few days after having chemotherapy, you need to use protection. This is to protect your partner in case there are any chemotherapy drugs in semen or vaginal fluid. But remember, cancer cannot be passed to your partner, and sex will not make the cancer worse. Any problems with concentration or memory, sometimes referred to as chemo brain, are usually temporary and mild. But while they last, they can be frustrating and interfere with your normal activities. They may delay some people from going back to work, school, or to social events. Keeping a record of your symptoms may help you work out if certain things make your memory worse. For example, you may notice that symptoms seem worse first thing in the morning or when you are tired or hungry. This can help you to plan your day so that you do more difficult tasks when you feel at your best. While many of the side effects we discussed can be simply managed by yourself or with some drugs, at times they might become worse. So if you are experiencing these symptoms, the Acute Oncology Service is available 24/7 for advice and support. Our website will help you check your symptoms and advise whether to call your GP, your cancer nurse, our oncology service, or A&E. There are a number of things you can do to help yourself. Your doctor and cancer nurse can give you more information and support.
Hi, I'm Ben and I'm a Macmillan counsellor. When you're diagnosed with cancer, it may mean that you have to deal with things that frighten and challenge you. It can all become overwhelming. You may have unexpected feelings and might not know what to do, but there's no right or wrong way to feel. Common thoughts and fears about cancer and having treatments can include feeling anxious and nervous about how treatment will affect you, not wanting people to treat you differently, feeling more isolated, worrying about work and money, thinking about how having treatment will affect your loved ones. Cancer can have a psychological and emotional impact that touches various aspects of your life, and sometimes you can feel stuck with adjusting to it all. Whilst this is common, there are steps that both you and your loved ones can take to help look after your psychological well-being. Number 1, adjusting your expectations. Your usual way of coping with illness and adversity may not work in the same way with cancer, and it's not unusual to find this tough. So don't set the bar too high. Pace yourself and set realistic goals that you can keep adapting as you make progress. Number 2, be kind to yourself. There's no normal path to follow or way that you should be coping. Everyone's adjustment is individual and may take time. Try not to judge yourself against others and show yourself some self-compassion. Number 3, set targets. Schedule plans to look forward to and to work towards outside of your cancer. Your illness does not have to be all that you are. Small realistic targets can help you see yourself making progress and prevent you from getting bogged down in current challenges. Number 4, use what you already know about yourself. Cancer is unlikely to be the first difficult thing that you've experienced. What has helped in the past when facing challenges? What is likely to trigger you feeling low or anxious, and what can you do to minimize it or help you manage it? Identify a first aid kit of things that can soothe you, things that you already value, books, films, ideas, notes to self, and so on. Number 5, make room for your emotions. It's important to allow yourself to be hopeful and positive, but it's not realistic or helpful to be positive all the time. Allow space for the negative feelings too, as they're a part of your reality. Just keep an eye on how much the negativity seems to rule your life and seek support if you get stuck. Number 6, take a moment to write it out. Difficult emotions crop up, and whilst it can feel uncomfortable, they don't always require you to respond or to make them go away. Trying to suppress or push them away can sometimes make them affect you in other ways. Emotions are normal, and often if you try to ride them out like a wave, they can pass on their own without taking over. Maybe try some mindfulness to help. Number 7, connect and communicate. It is common to feel more isolated. Resist the urge to isolate yourself. Try to reconnect with people around you or connect with people who may have shared experiences through support groups. Number 8, talk to us. Seek help where needed and communicate with your cancer team if you're feeling stuck, especially about the things that we might not always ask you about, like your mood or sex life. I hope you found this information useful. Don't forget, we're here for you.
Hi, I'm Helen and I'm an oncology physiotherapist. Becoming more physically active is a positive step you can take when you're living with and beyond cancer. Cancer and its treatment can feel overwhelming. Choosing to do something for yourself, like becoming more active, can help you feel more in control. There has been lots of research to show that being active before, during and after treatment is safe. Being more active can benefit your health in several ways. It can reduce tiredness, help you look after your heart, reduce anxiety and depression, help you keep to a healthy weight, strengthen your muscles, improve bone health, improve your flexibility and ability to stretch, improve balance, and increase your confidence. During your treatment, you may find that your energy levels vary from day to day. Physical activity is a very positive way of helping to manage the tiredness that is often experienced. Be gentle with your body. Be careful not to overdo it on a good day. It can be helpful to use a fatigue diary to keep a record of when you feel your best and when you feel most tired. This may help you to pace and plan your activities. You might be nervous about starting a physical activity plan, especially if you weren't very active before your cancer treatment. Here are some tips that may help. Research shows that even a little activity is better than nothing at all. Try to continue with your normal daily routine and add in small activities. For example, standing up and walking around the room, or doing a few exercises during a TV ad break, or stretching while you wait for the kettle to boil. As you start to feel more confident, you can slowly build up the amount of physical activity you do. Ideally, you should aim to do 150 minutes of moderate activity or 75 minutes of vigorous activity every week. You can do this as multiple episodes of 10 minutes, eventually aiming to be able to do a 30-minute block of activity. So what do we mean by moderate intensity? We describe this as feeling somewhat hard. Your body will begin to feel warmer, and you'll feel that you're breathing harder and faster, but it's still comfortable. You're still able to talk, but in broken sentences. If you're unable to speak or feel that your heart is racing, you're working too hard. Being more active does not mean you have to join the gym or buy equipment. There are lots of different options, and every way that you start to get moving really matters. It's about finding something that you enjoy doing, maybe walking the dog, dancing in your living room, or making changes like taking the stairs instead of the lift. It is also recommended you do exercises to build strength and improve balance twice a week. You don't have to purchase weights. You could use a bottle of water or can of soup to help with some of these exercises. Don't expect your body to be able to work at the same intensity that it did before you started treatment. It's busy dealing with the treatment that you're having. You may find that you need to reduce the intensity and the pace of your activity to accommodate for this. Don't worry about small setbacks. You can increase your intensity again when you feel able. If you weren't particularly active before, it's important that you don't suddenly start with an intensive program. Start slowly and build your activity levels up at a comfortable pace. The aim of being physically active is not to cause pain or discomfort. This is not a no pain, no gain scenario. Stop if you do experience pain. Do not exercise on days when you feel unwell or have symptoms that concern you, or if you experience dizziness, chest pain, racing heart rate, or difficulty breathing. If you have specific concerns, please speak with your cancer team, who may recommend you avoid certain activities.
Hello, I'm Georgie. I'm an oncology dietitian. A key step forward is taking a healthy, proactive approach to diet and lifestyle. Whilst this means different things to different people, whatever you can do will go a long way to helping you feel better, having more energy, and improving your overall health and well-being. Eating a balanced diet is important for your health before, during, and after treatment. Here at St George's, we have a team of specialist cancer dietitians available at any point. You can contact us directly or ask your clinical team to refer you. In addition to helping you maintain your weight, we can also provide advice on all aspects of diet and nutrition. People with cancer may have different dietary needs. Some people feel well and able to eat normally. For others, weight loss or a poor appetite were symptoms that led to their diagnosis. If you had eating problems before you were diagnosed, we can support you to improve your diet. Some eating problems may be related to the cancer itself and/or the type of treatment you are having. Depending on where the cancer is in your body, it can cause you to feel sick, be sick, feel pain, or have poor digestion. Some problems are temporary and improve when you finish treatment. Others may last longer. For anyone starting treatment, it's important to ensure you are eating well enough to prevent you losing or putting on too much weight. If you are losing or have lost too much weight, it's important to speak to us. Some side effects of treatment may impact your strength, well-being, diet, and ability to eat. Here are some dietary tips that might help you to alleviate their impact. When feeling sick, stick to dry foods and cold meals. Ask other people to do the cooking. Eat little and often. Try ginger, either tea, crystallized, biscuits, or ginger ale. You can also try peppermint tea, fizzy water, or lemonade. You may want to avoid strong-smelling, high-fat, or fried food. If you're experiencing diarrhea, drink plenty of fluid, but avoid caffeine and alcohol. Eat small and frequent meals, reduce fibre and fat, and avoid spicy foods. If you are constipated, increase fibre and fluid, and take gentle exercise. If your sense of taste changes, add extra flavouring, seasoning and spice, and try different foods. If you're suffering from mouth problems like soreness or ulcers, try soft foods, cold foods such as ice cream, sorbet and yogurt, and plain foods. You may need to avoid acidic foods like vinegar, hot and spicy food, garlic and onions, salty food, alcohol, and acidic drinks like orange and grapefruit juice. After treatment, it will take time to recover physically. Your diet may be different from how it was before. Living a healthy lifestyle after treatment will help you recover quicker and reduce the chance of developing diseases like diabetes and heart disease. We also recommend you keep a healthy weight. This may require you to gain, regain, or lose some weight. It is important to eat a balanced and healthy diet. Food is the body's fuel, so the better we eat, the healthier our bodies will be. If you drink alcohol, it's important to follow the government recommendations. There are lots of alcohol tracking apps and support groups on social media to help reduce alcohol consumption. There are some common questions people have about cancer and diet, which include: can diet reduce the risk of cancer coming back? Does sugar feed cancer? Should I take extra dietary supplements? What food should I eat when treatment causes low immunity? Can I only eat organic foods? And do I have to follow an anti-cancer diet? There is a huge amount of information out there about diet and nutrition. It can be tricky to navigate this and ensure you are getting accurate information. We are happy to discuss any information or advice you have been given about diet and cancer. We're here to support you as little or as much as you need. We can see you in clinic, on the day unit, or organise a telephone call. Your clinical nurse can refer you to our service.
My name is James, and like you, I am a cancer patient at St George's. In 2021, I had chemotherapy and surgery for bowel cancer. So I understand it is a lot to take in, and it is all quite confusing. But believe me, you are in great hands. They are experts. While the staff may look like they are always very busy, they will make the time to listen to you. What I have learnt is that communication is the key. No question is a stupid question. Your team are there to answer your questions and explain again if you didn't understand. For this video, here are the key messages to take away.